Thank you, everybody. So my name's Umang, and I'm not a technologist. I'm not a venture capitalist. My proper job is, in fact, being a pediatrician. I don't know how many of you spot this slide, but I became a doctor because I wanted to be George Clooney on the right. In fact, I went to medical school, went all the way through my pediatric training, because I thought my life was going to be like this, where I could run around, save everybody, and look cool whilst doing it. Of course, it's not quite like that. And in fact, all that happens is my friends send me photos of children's nappies and ask me what the problem is, rather than explaining that we need to do something different. In fact, I met George Clooney once, and I explained to him that this was my problem, and he said to me, "You should have gone to drama school, not medical school, you idiot." So I was left starting again at how I was going to try and impact and change the world. A few years ago, I joined a company called Babylon as employee number 10, and we're now up to 1,500 people or so globally, and our mission that we scrawled on the wall was how could we make healthcare more affordable, more accessible, and try and put it into the hands of everybody on the planet. I'm going to spend the next few minutes trying to explain to you what that looks like, if that's okay. The first part of that mission statement was about trying to make healthcare more accessible. And when we thought about that, we thought, of course, we could put it into mobile phones, but what about what's coming next? How come what we always do in healthcare seems to lag behind every other consumer technology that comes out? Why, if today everyone's using their mobile phones and WhatsApp, can't we start thinking about what they're going to be using tomorrow? Because that's what our patients, and in fact ourselves, expect. Why can't, for example, a medical consultation take place on a speaking device? We were told by Amazon that they expect to be in over 80% of US homes with one of their devices or something similar in the next 5 to 10 years. So why can't medical consultations look a little bit like this?
Hi, Alexa. I want to speak to Babylon.
Hello, Louise. How can I help you?
Well, I've been feeling a bit dizzy recently.
I'm sorry to hear that. Can you tell me a bit more? Do you feel like the room is spinning, or are you feeling faint?
Yeah, sometimes it feels like the room's spinning.
And have you noticed any hearing loss?
Yeah, I have actually.
Do you have a ringing, buzzing, or humming sound in one or both ears?
Yeah, both ears. It's horrible.
Do you have any pain in your ears?
No.
Have you had a fever?
No, none.
Have you noticed any discharge coming out of your ears?
No.
Looking at your user graph, I can see you had glandular fever a few months ago.
Oh yeah, that was awful.
For how long have you been unwell with these symptoms now?
A couple of months.
Finally, have you noticed that your ears are feeling full or blocked?
Yes, actually.
I think I might know what's been causing your symptoms. It is most likely to be Meniere's disease, a condition of the inner ear that can affect balance and hearing. It could also be labyrinthitis, an infection of the nerve in the ear. Meniere's disease needs a specialist opinion, and might be helped with some medicine to reduce the dizziness, so I'd recommend talking to one of our GPs.
Sure, sounds good.
Dr. Garcha is available straight away, and according to your calendar, so are you. Would you like me to book your appointment?
Yes, please.
All booked. Your phone will ring in just a minute, when the appointment starts.
So when we first started showing that, people thought, well, okay, that's cool. I now put to you that that's exactly what our patients expect. It's exactly what my 5-year-old would expect if she was booking her own appointment. So the next part then goes, if we're able to make healthcare more accessible, how can we do the other part of that, which is make it more affordable? Because there's no point giving people more access to doctors if it's cost prohibitive. So when we start thinking about healthcare, we try to define it in a way that will allow us to get more upstream and become more preventative. If you think about what we actually do for healthcare today, we don't deliver true healthcare, we deliver very good sick care. We, in fact, completely incentivize around providing care when somebody is unwell, as opposed to incentivizing around prevention. My favorite model for reimbursement of healthcare systems is traditional Chinese medicine, where you pay your doctor when you're well and you stop paying when you're unwell. That's got to be a much better system than the one that we all operate in today. And I believe that technology can help us get somewhere along that path by helping us understand that although people's symptoms often start, and from those symptoms we're able to then form the diagnosis, it's from that diagnosis that we can give the treatment, but from that treatment, we can then put you into that rehabilitation process to ensure you get better. Although that works really well as a pathway, and we talk a lot about clinical pathways in getting you to a better clinical outcome, that works really well for acute illness, but for chronic disease, we need to start thinking about something completely different. For chronic disease, we need to switch completely into healthcare rather than focusing on reimbursing sick care. We need to start being able to assess people where they are right now, and then from that assessment, help them make the right plan for where they are in their disease process and what they need next. Where relevant, we need to give them access to the right coaching. We've heard a little bit about this today, especially in diabetes, for example. And crucially, we need to be with them every part of that journey. So what we often do in healthcare today is we tell everybody to eat less and do more exercise. And of course, that's not going to be able to deliver the impact that we need. So we need to be able to monitor people and intervene at the right times. If we can do that, we'll be able to deliver true predictive preventative healthcare, which of course is a holy grail. We can't do all of that using technology alone. Of course, we still need to connect you up to doctors so they can give their expert opinion or give you a diagnosis or give you a prescription. And I'm still a way away from being able to remove your appendix using my mobile phone alone. So they're not part of our processes. We connect up to physical services to allow you to go off and get what you need in that system. So we deliver AI-led healthcare services through your mobile phone, as well as virtual healthcare services, as well as physical services in places as far and wide as the NHS in London and Rwanda in Africa. The final part of that mission statement talked about providing healthcare for everybody on the planet. So if I may, a quick example with numbers of what it's like to deliver healthcare in Rwanda. In Rwanda, there are 11 million people, give or take, but there are only 1,000 doctors. So it doesn't matter what way you cut it, that clinical workforce can't cover that population. In Rwanda, there are 18 million mobile phones. There are more mobile phones, apparently, than there are toothbrushes. So clearly, if you're building a healthcare system from scratch, you don't start by building buildings, you start by trying to utilize the technology that everybody's got in their pockets. We're very proud that we now have over 2.5 people signed up to our service in Rwanda, and we continue to be funded by the Gates Foundation to progress those services to more relevant diseases for that area. If you're going to deliver healthcare at scale, you can't do that relying on clinical workforces alone. We know that we're at least 5 million doctors short globally. So we've tried to build out the right artificial intelligence methodologies to replace and augment a doctor's training in a doctor's brain. We've started to build out a huge knowledge base because, of course, when you go to medical school, you learn lots of stuff. And from that knowledge base, we're able to make sure that we load in, using our clinical governance structures, the right bits of information that you saw in that first video, so that all of those nodes are up to date and the most relevant for that patient at that time. Building the world's most intelligent doctor is one thing, but it's useless if it has no bedside manner. Imagine if you went to see the world's best doctor and you said, "Hey doctor, my stomach's killing me," and that doctor said, "I'm really sorry, you need the police." We need to be able to utilize technology as well to create a better level of understanding, and that's why we build our own natural language processing in our offices in London, and we believe we have one of the largest ontologies available that's fit for purpose in this field. The final bit to dig into is simulation, which I think is the most exciting. So when we think about all of the data that we generate and is collected, and you saw there the user graph in the visualization on the first video, wouldn't it be amazing to be able to use that data, use that information to start simulating through a digital twin what might go wrong and how to best intervene? Our CTO comes from McLaren, the car company, and she would say before we even built the slightest, smallest part of one of our cars, we'd run hundreds of thousands of simulations on it before we put it onto the road or onto the track. Imagine if we could start doing that for healthcare. We, of course, do the exact opposite in healthcare, where what we do is we wait for something to go wrong and we try and bolt pieces together to try to fix it. Putting all of that together, we believe we can create a virtuous continuous learning loop that will help us deliver care to patients in a sustainable way, not only in our home territory in the UK, but far and wide. Bringing all of that together looks a little bit like this, and I'll just briefly show you this start point.
Hi, Louise. My name's Dr. Kultag Archer. Nice to meet you.
Hi, nice to meet you too.
So
I
when
can
our
see you've
doctors are having
completed
a
our AI
consultation,
assessment.
it goes a little
And
bit
from
like
this,
this.
can I confirm that you've been having dizziness for a few months now with some hearing loss and also some ringing in your ears?
Yeah, that's right.
Okay. You look quite comfortable at the moment. So does the dizziness come and go?
Yeah, I don't have it at the moment.
Okay. And when you do get the dizziness, how long do the symptoms last?
A few hours at a time, I'd say, probably. Yeah.
Okay. And does changing the position of your head bring on the dizziness? Sorry, what I mean to say is,
See from that video, what we're trying to then use is our technology today to save the doctors time, to allow them to not have to type and give them extra cues so they're able to best help patients. I started this by saying that when I joined, we were on this mission, and I was always reminded by the quote from Bill Gates that says that we, as people, always completely overestimate what we can achieve in the short term. I completely believed I was going to be George Clooney when I started medical school and underestimate what we might be able to achieve in the long term. I hope that's true, and if you'd have said to me at the beginning when there were 10 of us sat around a table that we'd be in all of these territories where we're now live in Rwanda, we're live in Canada, we're on 77 million Samsung mobile phones, and we've signed a deal with Tencent to potentially deliver care to 1 billion users in China, I'd have said that we were dreaming back then too. So finally, I think it is completely possible to provide accessible and affordable healthcare for everybody on the planet. Thank you very much.